to Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health. Welcome to A Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The office educates you about, you guessed it, integrative medicine. Today we have with us Dr. Vivek Jain, Director of the GW Sleep Disorders Center and Associate Professor of the GW School of Medicine and Health Sciences. Also, we have PA Ashley Drapeau of the GW Resiliency and Well-being Center and the GW Center for Integrative Medicine, where she is the Director of the Long COVID Program. Okay, so turning things over to Jennifer.
Hi, everybody. Thank you so much, Janet, for your introduction. So as you may know, I'm a dietitian and the chief instructor at the GW Culinary Medicine Program. And I just want to tell you I'd like to tell you what the program is and how you can register. So culinary medicine is a combination of the art of cooking with the science of nutrition. And the goal of it is to help people to understand how they could use food as medicine. And so the courses teach nutrition concepts along with literally how to implement them, starting from knife skills of how to cut an onion and a pepper, all the way through to much more advanced skills, and keeping in mind, making it very accessible, low cost, budget friendly, scalable. So made for cooking for one or two, or explaining how to, of course, scale up to a bigger group of people, how to budget plan, how to plan for meals. And it's very practical and it is rooted in science. And so what we do is help implement the changes through nutrition that could help manage and hopefully prevent chronic disease. So the courses are really fun as well. They help form a sense of camaraderie, which is kind of an added bonus, especially in these times. We run the classes right now. They are virtual. So you get to cook in your own home while I cook in my own home, and we're all together live on Zoom with all of your colleagues in the class. We have courses that run for 7 weeks. So it's once a week for 7 weeks for the beginner class. And then all the people who love it so much and want to take the intermediate class can then sign up for the intermediate class. We have several courses that are starting this fall. And so I'm just going to show you, I'm going to share my screen for a moment and show you the schedule in case anybody is curious. So we have classes on Saturday mornings, starting September 17th. So it's in about a week from 10 to 12:30. We have classes on Wednesday evenings, beginning next Wednesday, September 14th. Those are the classes that I am teaching. Wednesday evenings from 5:30 to 8. Starting October 2nd, we will have Sunday afternoon starting at 4. And then starting later in the fall, October 20th, Thursday evening, starting at 5:30. That is our schedule for the fall. So if you are interested in participating, I'd like to give you all that the website where you go in and you fill out here, I'm going to share my screen one more time. Sorry about that. Let me show you how it looks. I'm going to share my screen one last time. Here we are. So this is the class where if you click on our website, you see this photo and then the schedule. I'm clicking really fast, sorry. And then you fill out this interest form. When you fill out the interest form and hit submit, I am the one who gets it. And I will get in touch with you in a day or so and see which class you're most interested in joining. And so that's it. Does anybody have any questions? I can tell you that the class is really fun. People have really enjoyed it. There is no cost. Thank you for that really good question. Sorry if I didn't say it. The class is free. The whole point of this class is to share this information as a public health program. They're really fun and they are of no cost, but you do have to buy your own groceries. We do cook every week after the first week. The first week is an orientation week. And then after that, every week you're cooking a delicious meal every time.
I can concur.
Thank you. Janet was one of our star pupils. I just posted the website into the chat. Thank you, Kathy. Janet was such a star pupil. She did the beginner and then the intermediate, and she was really fun to have in class. I really, really enjoyed your participation. Thank you, Janet.
Oh, well, I enjoyed it too. And hey, you guys, you cook everything. You cook chicken, you cook beef, you cook vegetarian, you cook vegan. I'm gluten-free, so I had to, make little allowances for that. But it's not anything that anybody who has to cook to a specific dietary menu isn't familiar with. And you will learn how to make some of the tastiest salt-free seasonings that you've ever had.
Thank you so much. Yeah, we pride ourselves on helping people to understand we're meeting you where you are. And so if you're a vegetarian, if you're vegan, if you're carnivorous, if you are gluten-free, if you don't eat anything with lemons, whatever it is, our recipes are guidelines. And so we encourage you to learn how to flavor balance and substitute. So we're not just substituting any old thing. We want to make it delicious and beautiful. So this healthy food, it's our bar is that it's delicious and healthy and beautiful. And that's what we help you to do no matter where you are in your culinary journey.
And Jennifer, it's Elva. I wanted to say I concur. It was totally fun.
Thank you, Elva. Oh, it was so fun to have you in class too. I love the classes. I don't know if y'all will remember or everybody else. I get as excited being in the class as I am right now talking about it. So I hope you all will consider joining us. It's really fun, and feel free to fill out that interest form and also share it with your friends or family. Anybody in the DC region is welcome to join us.
And remember, it's free. Okay. Thank you for coming, Jennifer.
Thanks. Take care, everyone.
All right, so we'll start with the COVID Q&A. I'm not going to take a lot of the time because I want Dr. Jain to have some time to talk and have enough time. But it looks like we already had a question about, I just got my second Moderna booster. How long should I wait before getting the regular annual flu shot? You don't have to wait any amount of time. You can get the flu shot whenever you have the availability to do so. There is no waiting time. In fact, some people get them at the same exact time. So you don't have to wait. Does anybody else have any questions? I think largely in COVID news right now, I mean, the biggest thing is the bivalent vaccine has become available. And so that protects you against Omicron 4 and 5, in addition to, the original strain that was COVID. So, those are available for anyone 12 and over, as long as they're 2 months from their previous booster. But tested positive for COVID. So that's a good question. There's not a lot of data of how long you should wait between when you have actual COVID and you get a booster. However, I would say it's probably along the same lines as when as the information that's out there about when you had your last booster. So about 2 to 3 months is probably how long the COVID that you had is going to keep you safe from getting COVID again. So there isn't actual data out there. You could probably do it the next day, according to the CDC. However, I'd say, maybe 2 to 3 months would be okay. Any other questions? It is becoming flu season, so make sure you do get your flu vaccine. Sometimes it's hard, it's easy to forget flu exists with all of the conversations about COVID, but it still does. It still makes people very sick. Mid-October to mid-April. Yeah, so that's largely true. However, I would argue that because of, the changes with COVID, the flu has become a little bit earlier. There are some people testing positive for flu already. So it's changed a bit from recent years, but yes, you could get it October, that's fine. Am I seeing new long COVID cases? Yeah, unfortunately, there are still people getting long COVID even who have been boosted. Okay. Yeah, I mean, you could get a test before you get the booster, but you don't have to, for sure. But I'll continue to answer some questions in the chat if you have them, and I'll pass it over to Dr. Jain so he can tell us some awesome things about sleep.
Well, thank you very much for inviting me, and thank you everyone for joining. Uh, you know, obviously I'm a sleep physician, so I'm very biased towards sleep, but I can tell you that I think the reason I entered into this field is because I realize the importance of sleep, and I try to share that with the public. I should like to share that with patients. So just as an introduction, I came here to GW about 18 years ago, and we run a very strong sleep program. The place where you come in and do a sleep study, if that's what's required, is on K Street. It's an 8-bed sleep lab. So you come in in case your doctor recommends diagnosing things like sleep apnea or leg movement disorder or narcolepsy or other conditions that can be causing daytime sleepiness. But initially, you come in for an evaluation into the sleep clinic, which we have on 2150 Pennsylvania Avenue, which is the main medical faculty associates clinic. You come in, you get an evaluation, because sleep is it's a wholesome thing. The many aspects to a good sleep, ranging from, simple things like, am I sleep deprived? Am I getting adequate amounts of sleep? Am I following a good schedule? Am I, changing my schedules based on the weekdays versus the weekends? Do I have difficulty falling asleep? Do I have difficulty staying asleep? Are there physical things that affect my sleep, which we sometimes ignore, but are equally important in terms of how we feel the next day? And so when you come into the clinic, there's a thorough evaluation to try and screen what specific sleep problems one might be experiencing, and then try to tackle them, one by one. And yes, things like if you snore in your sleep, or you wake up gasping, choking, you wake up with headaches in the morning, you're sleepy in the daytime, that is one condition where I would say you need a sleep test, because it's very likely that you have sleep apnea. One thing I do want to point out, which always surprises our fellows and residents and students and faculty when I tell them this, is that even the complaints of waking up at night to go to the bathroom in a young person, or by young I mean, say one is 40 or 40 plus, and I don't have a big prostate, or I'm not a diabetic, or any other reasons to have the need to go to the bathroom at night. If I'm waking up at night, that could be a sign that I might be having sleep apnea. And it's important to find out if one has sleep apnea or not, because the untreated sleep apnea can lead to other issues, cardiac issues, specifically high blood pressure, increased risk for heart attacks and strokes. We also want to look for other so-called rare sleep disorders, which include things like narcolepsy or idiopathic hypersomnia, things that we used to consider, maybe, something that maybe more in a pediatric clinic or a children's clinic, but we do see these conditions in adults as well, so we don't want to ignore them. As a general tip, before I take any questions, I think a lot of non-medical sleep issues can be taken care of by all of us if we follow certain basic rules of what I call a sleep hygiene. It's always good to maintain a cool, quiet, and dark bedroom environment. Light is not a good thing for sleep. So all of us are guilty at one point or the other of having, pre-bedtime exposure to electronics and light. And, in most of my talks, I have a cartoon that shows somebody getting up right in front of the computer and going straight to the bedroom and wanting to sleep. And, that's something that does not happen biologically or physiologically. And that's something that we should all be aware of, that, the body and mind needs the winding down time. And so, darkness is important for sleep. Those of us who are night owls should be aware of the fact that early morning light coming through, say, a window can disturb sleep. And so, and for most of the night owls, I say, if you're going to wake up late, have blackout curtains on your windows so that the morning light doesn't even come in. People would always argue that if I wear a sleep mask, is that good? It is good, certainly to a large extent, if light cannot be avoided. But remember that light can sometimes be sensed through the skin as well, and even that can disturb sleep. Obviously, cool is important as much as we can. Ideal body room temperature should be about 70, 72 degrees for good optimal sleep. If one can achieve that, obviously, quiet is important. The other froze. I'm frozen. Did I lose everyone? Everybody's okay? Yeah. So a lot of us again are very guilty of having different schedules during the work days and different schedules on the weekends. There's a new term that came out more recently called social jet lag, and that is essentially the reason we call it jet lag is just like we travel, say, from here to Chicago, and there's a 1 hour time difference. Social jet lag means I'm not traveling, and yet I'm changing my sleep and wake times by an hour. So on the weekdays, supposing I go to bed at 10 and get up at 6, but on the weekends, I go to bed at 12 midnight and get up at 8. That is like jet lag, right? So I'm shifting my rhythms. And studies have shown that even 1 hour of difference between the weekdays and weekends can have an independent effect on my blood pressure to go up and me to develop heart disease. So that's why this term has become very, at least in the sleep circles, something that we all need to be aware of, called the social jet lag. So, avoidance of sleep deprivation, which is most of us need 7-8 hours of sleep, but also sleeping according to a kind of a good regular schedule, maintaining a cool, calm, or dark bedroom environment, winding down for X amount of time before bedtime, and that time varies from person to person. Avoidance of, obviously caffeinated beverages. People are differently sensitive to caffeine. Alcohol is a big disruptor of sleep. Even those who drink maybe once in a while, obviously cigarettes, nicotine. Many years ago, we used to be taught that exercising within an hour or so of bedtime is bad for sleep, and that's not true anymore. We now know that any exercise is good for sleep, even if it's done right until the bedtime. So please, exercise is important. Again, sleep is a very broad field. There's so many aspects to good sleep, including very specific sleep disorders that one can certainly evaluate for in a sleep clinic. But some things that we can do just at home, like, just by, I guess, common sense or good sleep hygiene. So I'll stop there and take any questions.
Can you talk a little bit more about the exercise question and what exercises are best if you're going to do them right before sleep?
Yeah, something, I'm not seeing these questions for some reason. So I'm glad that you, is it in the chat box? Maybe it is, huh?
No, I didn't put it in the chat box.
Oh, sorry. Okay.
I speak faster than I type.
Perfect. You're like me. Okay. Well, thank you for that question. So, there's no specific exercise that is better than another exercise. Most cardiologists will say aerobic is better than anaerobic, and I agree with that. So obviously things like walking, swimming, rowing, like flexing exercises are better than weightlifting or steady weight exercises. But the idea really is that these kind of body movements, exercising, burning calories, releases certain kinds of endorphins that are good for sleep, good for many things, but for sleep as well. Now, one lecture that I give is on sleep apnea, in which we've talked about different therapies for sleep apnea. But one interesting group of researchers does studies on looking at the effect of exercise on sleep apnea, and any exercise done, one doesn't have to go to the gym. One can just do 20 minutes of anything 3 times a week. And that can sometimes reduce the severity of sleep apnea by a significant amount. So just any exercise is good.
Thank you.
You're welcome. And any other, one thing that always comes up, and people will ask me, and I'm sure this is something that we all say, hey, if I don't dream, maybe I didn't get a good night's sleep. Just remember that dreaming is something which is, most of us have it, but we don't remember because we don't generally wake up from REM sleep. Let's see, are there some techniques other than meditation to quiet the mind? So the lots of questions are starting to pop up. So give me a second here. Let me go through them one by one. Let's see where we are. Okay.
You want me to read them for you?
I'm starting from if you don't mind, the top one is one question that I say it's fair to say that sex is great pre-sleep exercise. So That's an interesting question, but there's not. It's anecdotal, and most of us have experienced the sensation of good sleep after sex. So, but again, that's never been done in a good research way, and but that's a fair assumption. How many hours should one refrain from drinking caffeine before sleep? People are very differently sensitive to caffeine. I'm sure we all come across people who say, "Oh, I can drink caffeine like an hour before bedtime and have no problems." Those who drink at lunchtime and have problems. So one has to remember their own sensitivity to different substances. Alcohol is something which I think all of us are universally affected by. And so alcohol definitely disrupts sleep. But what are your thoughts on pharmaceutical sleep aids such as trazodone? Not just trazodone. My general opinion about sleep aids is that they are of limited utility in the long run. If one is having difficulty sleeping for whatever reason, that something needs to be addressed rather than treat the symptom. The analogy I use is that I can go to the doctor with a headache, and the headache is caused by a brain tumor. I can keep asking the doctor to give me a pain medication, Tylenol, opioids, codeine, whatever. But if I don't address the issue of the tumor, then my problem is not solved. So same thing applies to insomnia. Is it psychological? Is it stress related? Is it anxiety? Is it depression? Is it bad sleep hygiene? Is it all of the above? That needs to be addressed, not just taking a sleep aid. Stay well, man. I'd say that's a good assumption. All right, thanks. If you have a much difficulty falling asleep, how will a sleep clinic help you? Again, its main idea really is to address what could be causing your difficulty falling asleep. It could range from a physical thing like restless legs. It could be environmental. It could be circadian rhythm disturbance. It could be psychological. And so it's sometimes helpful to, after a discussion with a sleep physician, to kind of at least get an understanding of what might be the underlying etiology or the cause. Do you use CPAP machines a lot in your therapy? I do. I think it's still the gold standard for treating sleep apnea. There are many other non-CPAP treatments that are starting to come out and have been out for sleep apnea. Unfortunately, they still don't meet the standards of reliability, effectiveness, and long-term benefits as CPAP does. So you can take a dental appliance, you can take the pacemaker Inspire, you can take other surgical options. There are good alternatives only to somebody who's not able to tolerate a CPAP. Caffeine has a 6-hour half-life, but breakdown also depends on epigenetics. Good point. Absolutely. Yep. Let's see if I missed any questions. Janet, you can help me if I did.
Yeah, the only ones I think Janet's doing another podcast. The only ones you missed were, are there some techniques other than meditation to quiet the mind and fall asleep?
Yeah, so if I'm having difficulty falling asleep because I'm not able to shut my mind off, I think the number one thing to remember is if it happens once in a while, then it's not an issue. Okay, so when we talk about the true definition of insomnia, it has to happen more than 3 times a week for at least 3 months for it to be a diagnosis of insomnia, right? And then it goes back to the same thing. What are my pre-bed routines? If I'm supposing I'm a night owl, my preferred biological bedtime is say 1 o'clock in the morning, and my preferred wake up time is 9 o'clock or 8:30 in the morning. But my boss is horrible, and I have to be at work at 6 or 7, so I have to get up at 6 in the morning. For that, I have to get up at 5. So then I back calculate and do the math, and I say, hey, I should go to bed between 9 and 10 to be able to wake up at 5. So I go to bed between 9 and 10, but I'm a night owl. My biology, I can fight my biology forever, but I will never be able to fall asleep by so early. And is that changeable over time? Is it trainable over time? Absolutely. So I have to recognize, am I fighting my circadian rhythm? Am I fighting an anxiety disorder? Am I fighting my bad sleeping habits? Did I drink too much caffeine at lunchtime or after lunch? Or am I getting up from watching a very interesting movie, or am I getting up from seeing my Cox cable bill? What are the things that are stimulating me? So any relaxation technique is great. And I know the Wellness Center for Integrative Medicine talks a lot about these techniques and how to calm the mind down. What happens with the recall of the CPAP therapy equipment? I stopped. Yeah, so, certainly, absolutely, that's been a real bummer. Philips Respironics recalled the machine. They are replacing them. It's a very slow process. People are either continuing to use the recalled unit. Nobody knows the exact magnitude of the risk associated with the use of the recalled unit. Some patients absolutely don't want to take any risks, so they stop taking it. And some bought a new machine on their own if insurance didn't cover. Some bought a travel size CPAP, which they were already planning to buy. Some had older machines sitting around, which they hadn't used. They started using those. There's nothing, unfortunately, not much. You can register with the Philips Respironics and they will send you a new unit. Tracing fingers exercise, we learned from Dr. Yeager, helps me relax enough to sleep. Okay, that's a good thing. I had never heard of that, so that'll be good. People I know are talking about insomnia following COVID. Can you talk about that and what they can do and also do? COVID obviously was a great source of anxiety and stress for a lot of us. And slowly papers are starting to be published about the effects of COVID on sleep. And absolutely, there was a big jump in insomnia. Most of the insomnia in COVID happened in people who already had insomnia before and was perhaps being marginally managed with either psychotherapy or drug therapy. And so if people had underlying mood disorders, they were more likely to experience insomnia. So we didn't see much of insomnia in people who otherwise were good, healthy sleepers to start with. What we did notice is that a lot of us didn't realize that we were somewhat night owlish by nature. So, say before COVID, we were going to bed between 9 and 10. I think a lot of us started going to bed an hour or so later. The real extreme night owls totally, working from home obviously made it a lot easier for us to go to bed a little late and wake up late. We had that extra time in the morning instead of commuting or, not really having to dress up, So, certainly insomnia was a problem during COVID. Sleep apnea is when you temporarily stop breathing when you sleep. That's correct. Yep. People usually equate snoring with sleep apnea. Is that a good indicator? Somewhat. So in general, snoring is far more common than sleep apnea. So every 3 people who snore, 1 may have sleep apnea in general. So if one is to ask truthfully to all men in this country, 70% of them, 60 to 70% will say, I do snore, but only about 10 or 15% will have sleep apnea. So maybe the ratio is 1:4, 1:3.5 or something like that. Women, also about the same, so women will be about 30, 40% will snore, only about 5 or 10% will have sleep apnea. Definition in New Zealand is when you stop breathing for 10 seconds or more. That's correct. So certainly sleep apnea is defined in adults by a breathing pause, which is 10 seconds or more in duration. That's correct. Did I miss anything? Okay, let's see.
I think the only one you missed was, is it better to stay in bed if you wake up in the middle of the night until you fall back asleep, or get out of bed until you feel sleepy again? Yeah,
so there's something called a psychophysiological insomnia or conditioned insomnia. And the reason why we call it conditioned insomnia is just, based on the old Pavlov experiments, which was that, if I am in bed and not being able to fall asleep, and I'm awake having ruminating thoughts, thinking about yesterday, today, tomorrow. Essentially, if I'm awake in bed having negative experiences or negative thoughts, then it's best to get out of the bed and go to another room and do something else and come back only when I start feeling sleepy again. And the reason is that the environment gets associated with the problem. So if I am in a certain room and I have a negative experience, in my brain, that room becomes the source of that negative feeling, if that makes sense. And so that's the reason why we teach that if you're awake in the middle of the night and tossing and turning and looking at the clock and getting frustrated and angry, just leave the room, don't just stay in bed. Because of the association that starts developing over time between the negative experiences and insomnia. Weight loss helps significantly with apnea and snoring. That is true to a very large extent. And so that's obviously one recommendation. Short mandible is the other reason for apnea. That is true. So, retrognathia, micrognathia, backset jaw, small jaw. Those are anatomical reasons for sleep apnea.
Dr. Jain?
Yeah.
Could I interject for a minute? But please don't just associate sleep apnea with people who are overweight.
That is very true. Very, very true. And there's a rule of the thirds that I tell my fellows and students in general. So a third of the people that we see in the clinic with sleep apnea are young. By that, I mean less than 40 years of age. A third of the population is females. A third of the population is thin and not overweight. Absolutely, you're absolutely right.
So do we have any more questions for Dr. Jain?
Night owls can have any bedtime as long as there is a pattern and blackout shades. For example, I just saw a patient a few weeks ago who is, has a job that he's a night owl by nature, and until 2 years ago, he used to have a job that required for him to wake up in the morning and be miserable, earlier than his desired or biological wake up time. But now he does a job which is like he can go to, work until 1 or 2 in the morning, come home by 3, fall asleep, and get up at 10, 11 in the morning, and he's perfectly happy. So night owls, if they can sleep according to their circadian rhythm, it's not a disorder, it's not a disease. It becomes a disorder, it becomes a disease when there's a discordance between their desired and biological bedtime and an imposed bedtime and wake time. So that is when we try to shift people's circadian rhythms. And during the process, when we're trying to shift the circadian rhythms to a time that is desirable for their work, then they have to maintain a very consistent pattern. So they cannot have any pattern at all. They should have a fixed pattern that we teach them. I read recently that looking at the time can be a problem with encouraging insomnia. That is true, and it's just it's a trigger, right? So it's an arousal trigger in the middle of the night. If I'm having difficulty shutting my mind off and I'm upset and angry about something, and then I look at the clock, that makes my mind even more aroused, more triggered. Like, why is it only 4 o'clock? I wanted to get up at 5:30. Why did I get up at 4? So that's why the mind starts racing even more. The secondary anxiety sets in. There are extreme cases when some people's natural cycle is to sleep during the day and be awake at night. There are, unfortunately, it's extremely rare, and but it does happen, and it is, that's a very toughy situation. Very difficult to fix and treat. Correct. Yep.
Well, on that note, I think this would be a good time for us all to thank Dr. Jain for spending time with us this afternoon. We really appreciate it because you are a busy person.
Well, no, thank you. I wasn't sure how our timeline was over here today. So if I was too rapid in answering some of the questions, I apologize, but feel free to reach out.
Everyone was very engaged. I think you are probably our all-time winner for most questions asked.
The importance of sleep. I find it useful not to set an alarm. That's right. I like that. Yeah, very helpful. Thank you. Welcome. Thank you all. Thank you so much. Take care.
Thank you.
Awesome. Well, thank you so much, Dr. Jain. That was awesome. That was great. I think a good sort of shift from that as we turn to our mind-body exercise is to talk a little bit about the autumn, right? Since we were talking about sleep in particular, the autumn is a great time to come within yourself and get more rest. That's what the autumn and the winter is largely about when we're talking about, Chinese medicine per se. And what we're going to do a little bit today is talk about that, do some acupressure, some meditation, a little bit of Qigong at the end to help nourish you during the season. That's here, even though it feels like there are some days where it's still a little hot. The fall equinox is coming on the 22nd. And we are already, according to the Chinese calendar, in fall or autumn. And the two organs that are associated with the fall or autumn are the lung and the large intestine. And these become really important during this season, because the lung is also the part of your body that's thought to take in what in Chinese medicine is called wind. So wind is, considered the carrier of 1,000 diseases. It's sort of what in Eastern medicine we call like a cold-like illness, like the flu or COVID. They're all wind colds, wind heats. And our lung is responsible for fighting that off with what they call defensive or wei qi. So we really want to fortify our lung qi so that when we do come in contact with these different pathogens, our body's able to get rid of it. So the lung is responsible for producing this defensive wei qi, and the large intestine is responsible for detoxing our body and getting rid of things we don't need, which makes sense because when we think about conventional or what we know about the large intestine, right, it gets rid of the things that our body no longer needs, right, through stool, right, when we go to the bathroom. So as you can imagine, some of the things that sort of come up in Eastern medicine, we were talking about the large intestine, are things like constipation and diarrhea largely. And from a mental, spiritual perspective, that's a lot about what am I holding on to and what am I letting go of? If I'm holding on to too much, I'm going to be constipated. If I'm letting go too soon, right, because there's a balance, then I'm going to largely have diarrhea and be not feeling good in that way. So what are some ways that I can cultivate myself in a more natural way to strengthen these organs so that, this doesn't happen? I'm able to appropriately let go and appropriately hold on when needed. So a couple of these points we're going to talk about today, and then we're going to do a little meditation about them, about letting go, because it is autumn. It's a season of letting go, season of grief. So one of them is called lung 7. And the way that you're going to find lung 7 is if you go from your thumb, right? The lung channel follows your thumb. So a good way of finding it, or an easy way of finding it, and let me take off my watch because it might be easier for you to see, is if you put your two thumbs together like this, and then your pointer finger will fall right where lung 7 is. So you should be able to easily find it. You can then unattach to make it a little bit easier. Sometimes there's a little divot here. For myself, there's like almost a little depression. Sometimes it feels a little tender. That's okay. If it doesn't, that's also okay. But you just rub it in little circles. And this is a great, extremely important point in Eastern medicine. So it's a favored point when there's grief, sadness, and oppressive feelings in the chest. So it can be really beneficial. Sometimes it prompts an emotional release, which can be, come in the form of tears. Lung 7 also opens the nose. So if you're congested at all, it's a great point. It regulates lung qi, which we talked about is all about circulating defensive qi to fight off all those things that come. So if we get COVID or the flu, these are points that you want to be rubbing, right? You want to be rubbing lung 7 for sure. Or if you have an acupuncturist getting it needle, that's the first one they'll go to. It's great in combination with the next point we're going to talk to, which is large intestine 4. But not only does it do that, but it also helps with the neck, the face, shoulder problems, shallow breathing, can also help with constipation, lockjaw as well. So it has a relationship with the face too, which is important. And then the one that one goes well with is large intestine 4. So the way you find large intestine 4 is if you go from your pointer finger, this is the large intestine channel, right? So lung, and then its buddy, large intestine. And then you follow it down. This is the metacarpal bone. So you should be right in the middle. So if you come from this little area here between your thumb and your pointer finger and then slide, you can often find it. Many of you might know about this point. Considered the great eliminator. So it has a really awesome name too, which is wonderful. But this point is all about detoxing and letting go and relieving anxiety. So this point does a lot of amazing things. Not only does it let things go on a physical level, like if you're constipated, this is a great point to rub, or if you have a migraine, it's a good point to rub. But it also is great in terms of letting go of what our body no longer needs on a mental spiritual level. So maybe there's something that you need to detach from, in your life, something that you're sort of holding on to that no longer serves you. This is a great point because it mediates that while keeping the things that you actually need to be holding on to. It can also be good if you're finding it hard to connect with other people. It strengthens the chi and also strengthens that defensive chi. It opens up the exterior to allow all of that wind to come out of your body, because we don't want wind, right? Eastern medicine, we don't like wind. Is the reason why we get colds and flus. So this is also an amazing point if you're feeling sick too. So those 2 points, if you start to get sick during those next seasons coming up, rub these 2 points. And you can do it, what hand, it doesn't matter. It makes no difference. Do it on both hands would be better. And do it just till it feels comfortable. You don't have to do it forever, but do it just for a little bit of time, maybe 3 or 4 times should be fine. Oh, go ahead. Oh. I think maybe somebody's trying to talk. I'm not sure. Okay. So if you have a question, put it in the chat. Point out the one on the wrist again. Are you talking about this one or the one that's here? I imagine you're talking about the one that's here because this is closer to the wrist, a little bit further down from the wrist. Yeah. So what does it mean if it's tender? So it doesn't need to mean anything. It could mean that that point needs a little bit of attention. That's the way I sort of take it. Maybe it's a little deficient. Maybe your lung qi is a little deficient, but it doesn't necessarily mean that. And it's hard to tell without, feeling your pulses and doing some other Chinese medicine diagnostics. But it can mean that it's a good point for you, for sure. Yeah, so it's right there. And then while you guys are rubbing that, I'm going to get us into a little place that's a little bit more about letting go. So hopefully we can set the stage for that during this upcoming fall season, or this fall season that we're in. So I want you to take a deep breath in through your nose and out through your mouth. And just get in a comfortable position. If for you that's lying down or closing your eyes, whatever feels right for you. The points that you're palpating are largely on your hand and your arm, so they're not hard to get to. So you can really be doing this sitting or lying, whatever is feeling comfortable for you at the moment. And I want you to notice the gentle rise and fall of the body as the body breathes. And let yourself drop into a state of being rather than doing. And right now, just be present with the breath. Notice how our lungs just do this automatically without us taking any action at all. And as you watch the breath, thoughts will still arise because the mind is energy and it's always at play. And as you notice these thoughts, I want you to see if you can watch them as if from a distance. You're not your thoughts, but you're just a witness to these thoughts. It can help to visualize your thoughts as if they're clouds or bubbles. A thought arises, it floats up and into our awareness, and then if left alone, it will also float on by, dissipate or burst. Stay anchored to your breath as you play with awareness of this process. Present with breath, but aware of thought clouds or thought bubbles that arise. Like clouds or bubbles, understand that these thoughts are not solid, not fixed. They take shape and they break apart. They are continuously changing shape, blown by the wind, they come and go. We cannot grasp at a cloud or a bubble, and neither is there any point in grasping to these thoughts. So just let them be. Remain aware of the breath as the thoughts do their thing. Avoid chasing, following, or attaching to thought. Avoid trying to stop thoughts or push them away. Remain aware of the breath, aware of the state of being and not doing, aware of thoughts but not thinking. Take a deep breath in through your nose, out through your mouth. Practice lovingly allowing your thoughts to shift, change, and flow. Nothing to fight against, nothing to stop. Love your thoughts and at the same time, let them go. Remain present right here and right now with your breath. Recall that you are not your thoughts, but their witness. Look upon each thought with curiosity or awe, but again and again, anchor back to the breath. Breath awareness, present with breath. The mind is energy, and energy is always at play. And it's up to you to choose which type of energy you'd like to invite in, and then simply let the rest go. Take one last breath in through your nose. And out through your mouth, identifying with the energy of stability, even breath, steadiness, peacefulness, and ease. Okay, so we're going to do a little bit of Qigong, and you can feel free to do this sitting or standing, whatever feels right for you. I'll stand while I do it, but you can easily just do it sitting down. This is a good one to help your lung qi, like we talked about. We really want to strengthen our lung qi. We don't want to get sick. And this is a great way to fortify this in a natural sense. Okay, let me move this out of the way. All right, so what you're gonna do, it's good if you can have a little bend in your knees, feet hip width apart. Almost like you're sitting on a little bar stool. And just sit there in that for a minute. See how that feels, breathe into it. What they call in Qigong Ting, or just noticing, notice what comes up in your body. Sometimes what can come up is that this is sort of an uncomfortable position, and that's okay too. If it is, you can keep your knees straight if that's more helpful for you or more comfortable for you. But try to fall into the lower part of your body. You're really directing your energy so that you're grounded in the space. And it can be good to just start with a little stretch of the neck, from your shoulder up to your neck, if that feels nice. On either side. A little stretch is good. Sometimes you can do a little spine wave. We don't really move our spine as much, so it can feel good to sort of stretch that out and get some movement in our spine if you're able to. And so the way the metal Qigong goes is that you're going to move your arms, you're going to have them facing each other, and then you're going to move them away from your body, almost like a stop sign. And as you stop sign, you're going to unbend your knees. So you would take a deep breath in as you come down, and then breathe out as what I call like a stop sign. Breathe in, and then out. Almost like you're opening up that chest, right? We want to keep that chest really open. Elbows come in, arms straighten out, knees straighten out at the same time. Breathe in. And then breathe out. Then when I do Qigong, I do it a few times till it feels right. And then I let it go. It doesn't have to be this movement that's 20 to 30 minutes long. It's just a moment in time, a change, a pivot. And then always after I do a Qigong practice, I do a closing down. And a closing down is just when you put your arms in front of you, and almost like you're bringing that energy all the way down and pushing it into the ground. Mother Earth can handle it. You don't need to hold on to it anymore. You'll keep what you need and get rid of what you don't need. And I use closing downs often. Of all the Qigong that I do, I probably do closing downs the most because I do them whenever I'm feeling stressed, before a presentation. Anything that's causing me some unnecessary suffering is a good time to just sort of bring that energy down. If I have a headache, I use this one the most. And then it's good, you want to shake, get all that contaminated chi off of there, everything you don't need, almost like you have something sticky on you. You want to shake it off. Awesome. Well, it was so wonderful to have this time with you all and share this space with you. And I hope you learned a little bit more about autumn and are able to use some of this as you go about the season. But I'll take any questions if anyone has any.
Does anybody have any more COVID questions, flu questions, or mind, body, shaking it loose questions?
Oh, it doesn't matter what hand to rub. Rub both is better than one.